All right, well, it's Wellness Wednesday, and that means we have Dr. Ellen Rame right here from Southeastern Spine Institute answering your questions and our questions alike. How are you, Dr. Ellen?
Great.
Okay, I want to make sure that I do not pronounce this word incorrectly, but we're talking about neuroblastation. Did I say it wrong?
Neuroablation procedures.
I was really close, but so far. So tell us what that means and who's affected.
Right. Well, actually, we had a viewer question earlier about that. And you know, she had referenced whether neuroablation procedures could be helpful and whether they could be harmful if she had them repeatedly. And this viewer in particular was describing that she would have 9 to 12 months relief in her back pain symptoms following these procedures, and that she was also exercising like 5 times a week. So I don't know per se which neuroablative procedure she's talking of, but I do think that she's probably referring to radiofrequency procedures, which is a procedure that we do on small nerves in the back that help with low back pain that's because of arthritis in the back.
Okay, so that said, it would be affecting people that have arthritis, or it is arthritis of the back.
Right. So for people that have low back pain, there's, like we always talk about, it can come from so many different areas.
Yeah, and you said she worked out, so maybe it's even lifting the wrong way or something like that.
It could be. You know, that was one thing that I was going to recommend to her, is that, you know, anybody who has low back pain, you know, you may have more than one thing going on. So I don't think that exercise per se will make a nerve regenerate any faster if there has been a neuroablative procedure performed on that nerve. However, you may just be sort of prone to other injuries in your back. But I would say anybody who's able to go to the gym and work out 5 days a week, it sounds like whatever she is having done seems to be working at least pretty well for her.
Right.
But, you know, always, as we talk about, you know, try to avoid high impact activities. Swimming, stationary bikes, those are usually pretty safe things for people with low back pain. And, you know, and other things in moderation, you know. So it just sort of depends, like we always say, about the individual patient and each individual situation.
Dr. Ellen, you always have really good tips for us, and I remember a couple weeks ago you had someone come on and actually show us some different moves that you can do to stretch the back or make sure that your back is a little bit better. Maybe she just needs to get a good stretch in and it might help a little, do you think?
Yeah, absolutely. You know, you really want to focus on having that core strength as well as flexibility, and that can be very beneficial in terms of low back health.
Okay, well, we need to let people know where you're located, Dr. Ellen, so that they can get over there as well.
So we're off of Chuck Dolly Boulevard.
Okay.
And we're going to be moving into our new office building.
You know what? I know you're excited about the new office building. I'm excited about the new office building. There you go. So we want to make sure that you just I guess what we can take away from today's, you want to make sure that when you're exercising, make sure it's low impact, not high impact if you're having lower back pain.
Yeah.
And you said swimming, biking, other things like that, where you're not jumping around and pulling up on a lot of weights very quickly.
I think that's a good take home.
Okay.
And you can always come in and be reevaluated, and we can, you know, specifically, you know, look at your individual situation and give you ideas.
And we like to always tell people that just because you're going to the Institute doesn't mean that you're going to have some sort of surgery. There's lots of things that you can prescribe.
Oh yes, we have so many. That's the most exciting thing about the new building, is that we're going to have so many things under one roof that we can offer patients all in one visit.
Wonderful.
And we'll try to bring in some other things that we have available over the next couple weeks.
Yeah, we'll continue to please submit your questions to Dr. Ellen. All you have to do is go to abcnews4.com, click on the Low Country Live tab. Right there on the right side of your screen, you'll see Ask Dr. Ellen, and we'd love to get your questions. Dr. Ellen, thank you so much. It's always great to see you on Wednesdays.
Thanks.
All right, well, Wellness Wednesday continues straight ahead with advances in vision care that could stop the need for glasses and contacts. Stay with us.